Hello, and thank you for this opportunity to speak with you. I'm Marie Studer, Senior Program Manager at the Planetary Health Alliance, and I'll be sharing our experiences with building community and a social movement for global change. The Planetary Health Alliance, or PHA, is a consortium of over 340 organizations from more than 64 countries, and we have more than 18,000 individual members. Our work at the Secretariat is in service of our members working in planetary health, which is both a scientific field and a social movement based on understanding and addressing the impact of degraded natural systems on human health and on all life on Earth. We are working with our members to build a powerful new constituency committed to action on the Earth crisis and to create well-being societies. Planetary health is a transdisciplinary approach to addressing highly complex issues. It is also very dynamic and fast-paced. Because the work of planetary health is about creating a whole new way of living on the planet that significantly reduces humanity's ecological footprint and ensures social justice, there isn't a tried and true path forward. Therefore, our vision and values must guide our work and shape how we walk in the world. In terms of building community for all, we have several ways of gathering and listening to our members and participants. We have a networking platform called Hilo, where people can comment and share opportunities or ask questions on a daily basis. We share information from and with our community through our monthly newsletter. And there are quarterly community calls, which often have an agenda co-developed with input from our members. We ask for input and direction through an annual membership survey and during the Planetary Health meeting that takes place every 18 months and is usually co-hosted with global partners, such as the upcoming 2024 annual meeting that will be hosted with Sunway Center in Malaysia. It is through these efforts that we communicate and collaborate with each other. In addition to building a broad community through our members who come to us to be part of the Planetary Health Alliance, we also foster specific communities and working groups where we see energy and desire for planetary health information and action. These working groups amplify PHA's reach, inform our work, and help us move from creating a network to building a social movement. The first of these communities I want to tell you about is our Next Generation Network. This network is comprised of undergraduate and graduate students and early career professionals who are eager to create planetary health change in the world. Our Next Gen community is from all over the world, and they take on leadership roles in their universities, institutions, or by sharing their own initiatives. They often collaborate with each other, building bonds and geographically diverse approaches to planetary health challenges. Regional hubs are another very important community that PHA is intentionally fostering. We support the development of independently led planetary health regional hubs that function as locally rooted communities of practice, stitching together PHA members within geographic clusters to collaboratively advance planetary health research, education, policy, and outreach pertinent to specific local contexts. PH regional hubs were created as a response to members' interest in expanding intra and inter-regional collaboration and solution building, as well as assessing local manifestations of planetary health challenges and sharing these case studies with the broader global community, as well as applying planetary health research to local policy, on-the-ground interventions, and public outreach efforts. You can see here our list of 10 regional hubs. The other way we grow our community is through distributed leadership. The Secretariat has only 6 full-time people and a smattering of interns, so we need help to grow and do the global work that is urgently needed to create a livable future for all. To this end, we ask if there are people or groups within our community who have interest and bandwidth to lead a working group and build that community of practice. Current examples include the Clinicians for Planetary Health. This is co-led by Teddy Potter, who's at the University of Minnesota School of Nursing, and her colleagues. This group has about 1,000 or more health practitioners from 60 countries in it, and they are changing the way healthcare is practiced. The Education Working Group collaborates on developing educational resources and sharing best practices. And there are also special projects such as the São Paulo Declaration, which is a multi-stakeholder call to action across 19 sectors of society to create well-being societies. Recently, there seems to be some interest in creating new working groups around planetary health policy, spirituality, and movement building. If you have interest or ideas for these new groups, please let us know. So with that, I'll end here. I welcome you to join us in any way, shape, or form. Please join us as a member or reach out if you want to start a new working group. We are looking forward to changing the world together with you.